I'm Dr. Eleanor Menzin. I'm one of the partners at Longwood Pediatrics. It's hard for me to really remember what started my interest in medicine because I can't actually remember a time before I was interested in medicine. I do remember that I got these old 1950s Cherry Ames books from my older sister that were sort of like medical mystery books, like Nancy Drew, but about a nurse. And I remember that I was fascinated by the medicine in them, the sort of medical mysteries, and the fact that there was always a puzzle or a problem to solve. And I think that's part of what first drew me to medicine. And I remember really loving in those books the sense of teamwork and everybody working together, and the sense of dedication, that it was sort of more than just a job. So I remember around 8 or 9 going to my mom and saying that I thought I wanted to be a nurse. And this was in a much more traditional time where nurses sort of took orders and doctors gave them. And my mom said to me, Eleanor, you seem to kind of like being in charge. I think maybe you should think about being a doctor. And at the time, these doctors in these books were really remote. They just sort of like marched in, gave an order, and left. And I said to my mom, no, but the nurses have, the real relationship with the patients. And she said, well, yeah, in those books that's true, but in reality, doctors really can have relationships with their patients. And it turns out, thankfully, that she was right. Sometimes people ask me, young people who are starting their careers, if I would do it all over again, or they ask if I would want my own children to become doctors. And I always am sort of surprised by that question, because to me, it's such an obvious answer. Of course. I mean, I think this is the best job in the world. I get to come to work every day and think about interesting problems and solve new puzzles, and it's a different job every day. My partners are among my closest friends, and the nurses that I work with are too, and so I have this great atmosphere to work in. And I get this privilege of watching my patients grow up and really literally going from these cute little babies to being these sort of funny school-aged kids, and then to growing up into being real young adults. And that's such a gift. And I also get the sort of intellectual challenge of solving puzzles and having a new experience and something new to think about every day. So to me, it's still the best job in the world.